Balding corners which you want to fill by best possible hair transplant. Get ready to see hairline transformation which changed the looks of one of our patients. Also, if you want to see how you would look after your hair transplant procedure, you can now take help of Saraswat Hospital's PeekAI feature, the details of which I'll be very shortly sharing with you in this very video. आज हम बात करते हैं हमारे 27 years old patient के बारे में who had hair loss for last 5 to 7 years. He had no family history of baldness, but he was continuously having receding corners. He was actually around grade 3 Norwood Hamilton into baldness. उन्होंने कई डॉक्टर से कई सारे ट्रीटमेंट लिए. He even took dutasteride from one of his doctors, but there was no much benefit. Or then he came to us for consultation and to have a long-term planning and treatment. Though he was suffering from deep corners and slight thinning of hair, but our patient was very distressed and he avoided all social functions because of this hair loss. So it was very important for us to treat him, to give him riddance of this hair loss. At the time of consultation, we did a trichoscopy for him. By doing computerized examination of hair and scalp, we could find out that density at the back of scalp, density of grafts was 80 per centimeter square, or graft thickness was around 0.074 millimeters, which was good enough. Many of them were in terminal phase, which is good. Area of safe donor area was around 145 centimeter square, which again is good. So we could take out more than 5,000 grafts from his donor site without his donor site looking thin. The coverage value at the back of scalp at the donor site was nearing 14, so it was 13.55. So we could take out the required number of grafts easily. Please hit the like button so that we can make more such educational and informative videos for you. The recipient area in the front and little bit of mid scalp was around 47 centimeter square. The density of grafts we wanted to fill was 35 per centimeter square. So the number of grafts required was a little more than 1600, and because the number of hairs per follicular unit was more than 2, so it amounted to more than 3000 grafts in this recipient area. So the number of hairs which were required to be put in this recipient area was a little more than 3700 hairs. If you want to ask us questions regarding treatment planning, या आप अपने हेयर ट्रांसप्लांट के बारे में हमसे कुछ पूछना चाहते हैं या कंसल्ट करना चाहते हैं, तो आप कमेंट सेक्शन में क्वेश्चन पूछ सकते हैं, हमें व्हाट्सएप कर सकते हैं या इन नंबर्स पर हमें कॉल भी कर सकते हैं. The patient was sent pre-procedure instructions 3 days before. So when he came to us, he was well prepared with a heavy breakfast. Then we made a hairline design for him after sensitivity test. Hairline was designed as per his wish so that the problem which he had with the corners was taken care of as he wanted it to be. Then we took him for surgery. After giving a ring block anesthesia to him, after giving a ring block local anesthesia, we then made the slits. After making necessary slits by a new tool which is sapphire blade, we then started with the graft harvesting procedure by FUE method. All of us were wearing good magnifications at the time of surgery. We extracted the terminal hairs. This is called cherry picking. Later, our staff segregated 1, 2, 3, 4 hair grafts, and then we put all the graft in his pre-made slits. At the end of the procedure, a bandage was done. All post-op instructions were told to him. He was given a bag of medicines and he went home. Patient returned for review at 1 month, 3 months, 4 months, 5 months, and 6 months, and you can see how his hairline became better and better in each visit. You can also see the hair combing videos in the 6th month after the procedure. His look changed, his confidence came back, and now he was no longer distressed. Please subscribe to this channel for more such educational and informative videos. If you want to know how you would look after your hair transplant procedure, you can now take the help of Saraswat Hospital's app PeekAI feature. This is a wonderful, great algorithm which tells you how you would look after you get your hair transplant done in 3 easy steps. Step 1. Download the app. Step 2. Take the quiz. Step 3. Upload your pictures as the instructions are given in the app. It may take 24 to 48 hours for your pictures to return back to you after they are viewed by ABHRS doctors. Also, you can find out how many grafts would actually be required by you in your hair transplant procedure. And you will get to know the important questions which you should ask your doctor when you go for consultation for your hair transplant. So download the app today. So what is the take-home message of today's video? Number 1, you can take the help of PeekAI PeekAI to understand how you would look after your hair transplant and how many grafts you would require. Number 2, always go for hair transplant to a center and to a doctor who have good credentials. You know that they have studied well, they go to international and national conferences. Then you should see that latest tools and equipments are used for your procedure at your center. Nonetheless, the team which is there for you and the doctor himself or herself should be experienced. Last but not the least, there should be people to take care of you after your surgery, because you are the one who is very special, whose safety is of utmost importance for your doctor and your center. Share this video with your family and friends who are contemplating hair transplant. If you want to know cost of hair transplant, please click the link on the left, and if you want to see our latest hair transplant video, please click the link on the right.